All right, let's get right into this. We're going to explore something that's, well, it's both fascinating and, frankly, a little bit terrifying. This all comes from a really important medical paper by Xin Zhou and Sarah A. Ahmed, curated from Dr. Louis Campanella's files. The paper's all about the dual roles of fungi, how they can be allergens and also pathogens. And it gets at how an organism we breathe in every single day can be either a tiny nuisance or a total silent killer.
So it all really boils down to this one question. When you breathe in a totally common fungal spore, are you dealing with just a minor inconvenience or a villain that has a secret identity? Is it just an allergen that's going to make you sneeze? Or could it be a deadly invader, just patiently waiting for the perfect moment to attack? Well, the answer is in this incredible biological paradox. Fungi lead this deceptive double life. Now, the organism itself, it doesn't change. But the way our body decides to respond to it, that can mean the difference between a little discomfort and a life or death situation. And what's the one thing that decides it? The state of our own immune system. Just look at these two paths. They could not be more different. For most of us, right, with a healthy immune system, breathing in that spore, it just triggers a normal allergic reaction. Yeah, it's an annoyance. You sneeze, maybe your asthma flares up, but you deal with it. But for someone who's immunocompromised, think a transplant recipient or a cancer patient on chemo, that exact same spore doesn't set off any alarms. It just slips right past the body's guards and starts a quiet, invasive infection that actually destroys tissue. And that, in a nutshell, is the fungal paradox. One single organism, but two totally different results. The fungus isn't good or bad. It's all about the battlefield, which is our body, and whether our defenses are actually up and running or if they've been shut down. So, to really see this paradox in action, let's zoom in on the main culprit that the research highlights, a fungus called Aspergillus. This is a mold that's so common, we probably breathe in hundreds of its spores every single day without even knowing it. And it is the perfect example of this dangerous double life. So here you have it, the two faces of Aspergillus. On the left, in someone with a hyperreactive immune system, it causes something called ABPA. It's a severe allergic reaction, but it's contained to the airways in the lungs. Now on the right, in a person with a suppressed immune system, it doesn't just hang out in the airways. Nope. It actually crosses over into the lung tissue itself, causing invasive aspergillosis. It's really the difference between a loud, messy fire alarm and a silent, deadly saboteur. And the stakes for that silent invasion? They are terrifyingly high. The mortality rate for invasive aspergillosis is over 50%. Just let that sink in for a second. For more than half the people who get this invasive form of the infection, it's fatal. This is not some minor complication. Okay, now this is where the story takes a really critical and often tragic turn. We're going to look at how the very treatment that's designed to help can become a fatal mistake. It's known as the steroid trap. The research summary just says it perfectly. Imagine your body is a fortress and it's under attack. The steroid trap is like seeing the enemy at the gates and mistaking them for a protest inside your own walls. So what do? You tell your guards to stand down, to calm things down. But by doing that, you've just unlocked the front gates for the real enemy that's been waiting outside. Let's just walk through this tragic sequence of events. It all starts with a misdiagnosis. A doctor sees inflammation in a high-risk patient and thinks, okay, severe allergy. So they prescribe the standard powerful treatment, corticosteroids. But here is the catastrophic twist. Those steroids don't just calm an allergy, they completely tear down the body's defenses against that fungus. And the result? The invader, which now has zero resistance, just goes on an absolute rampage. And it's so important to understand that this isn't just about Aspergillus and it's not just about the lungs. The fungal paradox is a systemic threat. The same principle applies to other fungi in other parts of the body too.
Take Candida, for example. It's another super common fungus. For most people, maybe it causes a skin allergy. But in an immunocompromised patient, it can get into the bloodstream, a condition called candidemia. And once it's in the blood, it is a body-wide threat, with a mortality rate that can be as high as 40% in hospitalized patients. See? Same organism, same paradox, just a different battlefield.
So the double life, the steroid trap, the systemic threat, it all points to one single inescapable conclusion. The most important factor in these cases is making the right diagnosis and making it fast. And this brings us to what the research calls the final pearl, the ultimate clinical takeaway. To really take care of any at-risk patient, you have to know the difference between an allergic overreaction and a silent fungal invasion. Because, as we've seen, treating the wrong one isn't just a waste of time, it's actively helping the enemy. The key, the absolute key, is to suspect fungus early and to test for it. And all of this leaves us with a final, pretty unsettling thought. The fungal paradox shows us how a common, everyday organism can be hiding this hidden, deadly potential that's only activated by our own vulnerability, which kind of makes you wonder how many other threats out there in our environment are operating in disguise, just waiting for the right opportunity.